the toxicity was a somewhat unexpected finding when we first started seeing very good responses to therapy. In particular, patients with acute lymphoblastic leukemia would develop fevers, mental status changes, sometimes low blood pressure, and this required ICU care. And while this is almost universally reversible, at times our patients who developed what we call the cytokine release syndrome would require a more extended stay in the ICU. We started to be able to modulate this by lowering the dose and being able to try to figure out what the etiology is of this syndrome, and it really is a very profound immune response, as you would get with the flu, except this is not an anti-flu immune response, but an anti-tumor immune response. And so we acknowledge that it's very gratifying to see the responses. We acknowledge that we need to also look at ways of making delivery of this technology safer so that patients don't have to go to the ICU, and potentially one day that this can be an outpatient treatment where we simply infuse the patients and send them home. But we're not there yet. And so we need to have continued, well-focused clinical trials which are designed to not just look at anti-tumor outcomes, but also to collect samples so that we can better understand the biology of the cytokine release syndrome, so that we can find ways to tackle this side effect and minimize it as much as possible.